right renal artery, and this is left renal artery. So now this is called isthmus. This isthmus is nothing but the renal functioning tissue. Renal functioning tissue, which tissue? Cortical or sinus? Cortical. And cortical looks like a hypoechoic. We know that, right? Hypoechoic. So sonographically, what you are going to see, look at here. Sonographically, in transverse view. In transverse view, you will see this is the spine. And you will see this is aorta. And anterior to the aorta, you will see there is a hypoechoic mass. You feel like there's a band of hypoechoic tissue. Okay? This is a band of hypoechoic tissue. If you see this type of, this is aorta, then you have to look for the kidney. Oh my God, I learned that it could be the isthmus of the fused kidney. Let me see the two kidneys are isolated, separated or not. If you see no, there is no way I can make the kidney separated, then you have to understand it is fused. And they ask which pole is more or usually fused? Lower pole. Superior pole can be fused, but it is less than the lower pole. Okay, so in this way you can identify horseshoe-shaped kidney. Now single or fused kidney. Single, which is fused. Actually, it is not a one kidney. Two kidney developmentally they are so closed, but during the development they failed to be separated. So then what happened? Two kidneys are fused together and those are in one-sided. So single kidney. So now, normally, developmentally in the pelvic cavity, so in the pelvic cavity, this is pelvic cavity, so two kidneys are growing side by side. But they need to be isolated, but somehow they fuse together. When they fuse together, so then what happened? So they are moving in this side. So then there will be kidney here. And with this there will be another kidney. That means this kidney is fused with this. And what going to happen the other side? No kidney. So this is the criteria. One side there is no kidney. Right, I have to look for the other side. Is the kidney present? Yes, present. Hey, measure the kidney. It looks like two kidney fused together. So what your assumption? The size would be
larger.
So in here there is no kidney, but in here you will see two kidneys. How sonographically for the adult I can say this is fused kidney? Okay, how can you say? হ্যাঁ আমি পড়াচ্ছি বলো কোথায় বস Okay, so now kidney size will be bigger, usually 14 centimeter. Let me draw the kidney. If you get the kidney, then you will see this is the kidney cortex. Look, this is the band coming from one surface to the other surface. And it crosses the total sinus. It fused with this cortex to this cortex. But column of Burton, you heard about it, right? Column of Burton is, look at here, I'm drawing here the column of Burton. Look, how can you differentiate the column of Burton? It is just extended towards the sinus, but it did not fuse with the other end. You got it? So this is fused kidney, and this is column of Burton. So that's the way you can separate. So now, if you measure from here to there, then you will see it is greater than 12 centimeters. Okay? So now question, if it is a fused kidney, that means two kidneys are together here, right? So how many renal hilum you going to see?
2.
It's supposed to be 2. So there might be 2 hilum, right? If there is a 2 hilum, so here 1 hilum and here 1 hilum. So now if it is supplied by one renal artery, so one renal artery is coming. So then what happened? Renal artery is splitting. Then it goes to supply the kidney. You got it? Or there might be a duplicating, no, not duplicating, there might be the 2 renal artery, but the left sided renal artery may come back to here. Congenitally it can be anything. But most of the time, if this kidney is absent, then renal artery on this left side will be absent too. So then most of the time it happens this renal artery is splitting. Click the color. What are you going to see? The 2 artery is going through the 2 hilum of the kidney. And on the left side there is missing. Okay, so this is single fused kidney.
They both always function?
Yeah, those are functioning. Patient may not have any problem. So next is duplicating collecting system. What is duplicated collecting system means? In one kidney, duplicated collecting system. In here, both sides there are kidneys. But one kidney in either side has a two hilum. And two hilum means two pelvis. Collecting systems are duplicated, means minor calyx, major calyx, renal pelvis are twice. So now, this is kidney. Okay, duplicated connecting system. It may be supplied by one renal artery that goes everywhere, or it could be splitting. So now this duplicating connecting system is not good all the time, because what is the destination? This ureter, their destination is bladder, right? Bladder. This is bladder. So they have to open inside the bladder. But usually, what happens? They may be open into the bladder separately, number one. They may be blocked. One could be blocked over here, and there would be uterocele, collection of urine in here. Uterocele. Or it could be like this. There is nothing. It could be joining with the others. Okay, so this is not a good one. Could be very skinny and not connecting into the bladder, connecting with the others. So duplicating collecting system, you have to click the color, then you will see the two renal pelvis. Here you will see two renal collecting system. Two renal collecting system means two renal pelvis. Okay, and how we sonographically you may not get it. If not, so then IVP, contrast mediated X-ray, can identify this duplicating collecting system clearly. Okay, so next is mal-rotated kidney. What is mal means? Means abnormal, which is not normal. Okay, mal-rotated. Mal-rotated kidney. Normally, the kidney is hilum. This is midline, right? Kidney hilum is towards the midline. And this is called lateral. Right? Normally, the kidney is like that. But if this kidney is rotating like this and the hilum is anterior, 90 degree, it is rotating at 90 degree, then what happened? The hilum is now this way, right? So this is the hilum, the opening. And you are scanning, then which part of the kidney is close to the kidney transducer?
The hilum.
The hilum. So sonographically, sonographically you will see the kidney hilum is towards the transducer. So this is anterior, this is posterior. That means hilum is towards the anterior. Towards the anterior. Okay. Okay. One more thing I figure it out. The fused kidney, if it is fused in the pelvic cavity, so then it looks like a pancake. Because I forgot to tell you. Okay, that's the way it is. So in the pelvis you might see a pancake. That is the two fused kidney in the pelvic region. Okay, and this is malrotated kidney. Malrotated kidney, hilum is towards the anterior, period. Okay, so, and malrotated kidney is a functioning kidney? Yes. But malrotated kidney, you will see the hilum is towards just under the abdominal wall, and they should know better because any trauma is a big challenge. Okay, so now I will talk about the hypoplastic kidney. What is hypoplasia means? Hyperplasia and hypoplasia. What is hypo? Hypo means is it big or small?
Small.
Small. Hypo means small. Hypoplastic. Hypoplastic kidney means small kidney. What is the normal adult size? Normal size. So length is 9 to 12 centimeter, right? So in hypoplastic kidney, the kidney is less than 9 centimeter. Less than 9 centimeter. So normally the kidney, which kidney is little bigger? Left kidney is bigger than right kidney. How much it is bigger? So up to 2 centimeter. So if the right kidney is 10 centimeter and the left kidney is 12 centimeter, then I will say, yeah, it is still within the range, it is normal. Unless there is some pathology I can see. If it is normal looking, I will say it is normal. But if the right kidney is 10 centimeter and the left kidney is smaller, and I found is 8 centimeter, that is called hypoplastic kidney. So now question, what do you mean that if it is a hypoplastic kidney, what could be causes? Congenitally, one could be small. Then what could be the other causes? We have to understand that kidney gets its arterial supply, its nutrition, oxygen by the renal artery. Renal artery. By any chance, if this renal artery is stenosis, then what happened? It's not getting enough blood, enough nutrition, enough oxygen. So as a result, this kidney is getting smaller gradually. Right?
What happens if like the spleen is just enlarged? Would it not have room to grow big?
Say again? Which one?
Could it be small if like the organs around it are enlarged and then it didn't have room?
Usually not like that. That's the way. All genital signal, they will accommodate each other. Not like that. So now, question is, if you see the bilaterally, kidneys are small. One kidney is 9 centimeter, another kidney is 8 centimeter. Bilaterally small. So if it is a bilaterally small, that means it is really a challenging for that person, because kidney has to work. And if one kidney doesn't work, the other kidney has to work double. But if the kidney is small and tons of work you imposed on the head of the small kidney, so what's going to happen to the small kidney? It may not compensate all the work. It may not accomplish all the work that a kidney needs to be done. So then what's going to happen? Patient will develop signs, symptoms of renal failure. What is the most important marker for signs, symptoms of renal failure? Urea level will go up, blood urea level, and the creatinine level will go up. And what's going to happen? The blood pressure. It's going to go up. Okay, patient will not fail good. So now, what are the causes of renal hypoplasia? If the both renal artery is stenosis, progressively getting stenosed, both, there's a blockage, or there is a medical renal disease. Medical renal disease, example, high blood pressure, diabetes. So that can cause gradual damage or death of nephron. As a result, the kidney size will be smaller, 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 and hyperechoic. Okay, so this is hypoplastic kidney. You have to measure the kidney, then you will see, oh my God, the kidney, both the kidneys are small, or one kidney is small. Then you have to right way, you have to think, if both kidneys are small, so most common cause is diabetes and high blood pressure. If one kidney is normal, another kidney is small, then you have to understand there might be renal artery stenosis on that side. Okay? So then they will do further procedure, renal arteriography. They will do it. IVP, they will do it. So then they will figure it out. What is the problem? So now renal ptosis. What does ptosis mean? Abnormally hanging with the ligament, suspensory ligament. Normally the kidney is attached with the posterior wall, with the gyrotous fossa. And if the renal capsule, perinephric fat, gyrotous fossa, all are very loosely attached with the kidney, then what happens? Just you are hanging something with a rubber band, right? So rubber band getting loose, and the materials that is hanged is going down. So now if there is a renal ptosis, that means, let me draw a diagram for you. So this is kidney. And the kidney is hanging with a ligament. And if I am standing and I am supine, when I am standing, the kidney will hang down into the pelvic cavity because of the gravity. It's going to go down, right? So if this patient is standing and having an X-ray or any procedure, but patient is standing, so then this kidney in here is now hanging down in here, right? Usually the kidney, the renal ptosis kidney is in the pelvic cavity. But this patient is now having X-ray, patient is in supine condition. So then what happened? This kidney was here, right? Now this kidney will come back here. You will see the two different variation of position in standing and supine. That means the kidney is very loosely hanging with ligaments. So that is called ptosis kidney. So this is identified usually when you scan the patient in both views, standing and supine. But this is normal functioning. What is the danger of ptosis? Twisting. Right? It could be what is called rotation, malrotation. Okay, twisting, and that is emergency. You have to open the belly.
If they notice that, do they fix it right away or they wait till there's a problem?
Oh, when they notice it, so it is better always open it and fix it with the surrounding tissue so that it cannot be hanged or moved all the time. So now, supernumerary kidney. What is supernumerary? Supernumerary kidney. Supernumerary means by the number it is more than 2. That means normally we have one-sided one kidney. One side, one kidney. But if you see on the right side, there is double kidney. Okay? If you see double kidney, when there is a double kidney, there will be a double collecting system. And the other side is normal. When there is a supernumerary kidney, why did it happen? Because congenitally, one-sided kidney was duplicated and they are attached each other. So then size of the kidney will be longer. And it has a duplicating collecting system. And
so it would have a cortex in between too, right?
huh?
It would be a cortex in between, like the band
Yeah,
in
yeah,
between.
yeah. And you will see that its length is high, and you click the color, you will see the two hilum.